topics and opinions expressed on the following show are solely those of the host and their guests, and not those of W4CS Radio, its employees, or affiliates. W4CS makes no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. Any questions or comments should be directed to those show hosts. Thank you for listening to the Cancer Support Network on W4CS.com.
It's Arthi with Light Up Your Life, and it's already mid-November, and I'm so excited to be with you all again for another episode. And of course, I start off by highlighting my week to share with you, and also some things that are happening for us on our front. And so this past week, I was in an intensive, what's called a grief recovery method training. And I have, of course, in my background, worked with loss in many ways, especially hearing client stories, and then, of course, witnessing my own. And I actually decided to take the training to actually further the practice and to be able to meet clients where they are. Little did I know how much my life would be impacted over the last 4 days. The program is so amazing, and I highly, highly am so excited to introduce it in my own practice to those who are willing to do the work. It is intense work. Individual sessions would run, we would meet for seven times are the sessions, and then group settings are for 8. Right now, of course, I can offer them in person, and soon my goal is to be able to offer them virtually for those of you who don't live in our Hampton Roads, Virginia area. But and I can always refer you if you are interested to someone in your area as well. We have a whole network. There's so many grief recovery specialists. And why I love this program so much is because it's evidence-based, which I really believe in, because I think we need to start looking at programs that have validity, good research in the sense that they overall work. And then, of course, adding your personal touch to everything makes it yours, but just having good grounding in what we're doing. The reason why I love this program so much is it really believes in completion, and I will hope to get someone on in the new year who has been doing it for a while. But the idea is that loss is not just death, right? We have a loss of job. We had a lot of loss during COVID, right? Many people lost their homes, their income, their business. Things shifted. And the great thing about this is it eliminates all of the myths that we carry so much, like time heals all wounds, or that's a big one that we often hear. And there are people who've been carrying a lot of grief around for more than just from COVID, but from previous. So it's called compounded. They've just, all these experiences that they've witnessed have really changed their lives. So I share this with you because I really believe in the program. It's called Grief Recovery Method, and soon we'll be updating our website to add this component also, because I really highly believe in it. I didn't even bring up physical loss. When your body's changing, when you're aging, we really are able to delve into loss in general. And you walk out with what's called completion, not closure. The relationship, if it's somebody that you've lost, is never done, even when they're gone physically. Same with Even if it's a divorce, you share children, or it's just never full closure. So the word is completion that we use in the program. Things become more complete when we get a chance to look into them. And I have to tell you, I know it's hard to do the work. Trust me, I had to do my own work for the last several days, but it's highly, highly important, and it's life changing. And really, um, it's almost like, you know, your broken heart, or pieces of your heart, are no longer broken, right? They start to come together, and it's not that wound after wound keeps adding up. And we were using the word stuffing a lot. We're so used to stuffing everything in. So, um, again, something like this program can really help to not stuff everything and bury it inside, and to deal with all the losses, the many, many losses, that we all face. And I didn't even bring up pet loss, just all of the losses that are faced in life. The list is so long, and we could spend hours on that. But one episode, we'll spend some time looking at the method, and if we can find a specialist who can really help, where we can have that engaging dialogue for you all to understand the difference between looking at this method versus some other programs. And just knowing that there's a variety of tools and different ways of doing things. So today's episode was supposed to be with a holistic nutritionist, Amanda Elise Love, um, but we will have to have her come on to share her story at a different time. But I did want to still take this opportunity to still discuss fibromyalgia. Um, my knowledge base is not extensive in fibromyalgia. I do know some people who have suffered from it, in terms of just mentioning their chronic pain with fibromyalgia. And um, I just wanted to introduce this concept because of the fact that there's a lot of myths around this particular chronic illness as well. And I think it's important to highlight um, that once we debunk some myths, especially health myths, and we start addressing things and giving them a name, um, and ownership of it, then I think it becomes easier for consumers all around, family, friends, the actual client or the patient, for them to also understand what's happening with their body. And so, what Amanda and I were going to discuss is not only fibromyalgia, we were going to go into specifics of how she's targeted as a holistic nutritionist, who specializes in working with those with um, fibromyalgia, using nutrition to kind of combat some of the effects, but also how she uses nutrition in her practice in general. But we will have her on at a different time. But so today's topic is we're still going to talk, because we're going to share a video with you. It's called the role. Today's topic is called the role of fibromyalgia on life, because it is a chronic illness that people do have, that indeed is just pain that manifests all over your body. But it's not a nagging pain, right? It's like this pain that continues, and often people who have fibromyalgia, even on touching their arm, they feel pain. So it's just, if you can imagine that sensation of debilitating pain, and what it can do to you and your body and your mind and your spirit. So, for those of you who may not even know anyone, I just want us to have general awareness around this particular chronic illness. So, Roxy, do you mind sharing our video with us? So, everyone, this is a video. I highly, like many, value the work of uh, the Mayo Clinic, and the Mayo Clinic does extensive research and work. So when we watch this 20-minute clip, when you all witness the fact that it is, they have a whole center that's around fibromyalgia, um, and chronic fatigue clinic. It's called it will remind you that this is an actual condition. For so long, there are myths around, is this real? Why is this person talking about their pain all the time? So you're going to find out today this is indeed a real condition, and the person who faces and what they face.
Welcome to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McCrae.
Fibromyalgia is a condition that causes pain all over the body, sleep problems, fatigue, and often emotional and mental distress. Researchers believe that fibromyalgia amplifies painful sensations by affecting the way your brain processes pain signals.
According to the Centers for Disease Control and Prevention, fibromyalgia affects around 4 million U.S. adults, or about 2% of the adult population. And here to discuss fibromyalgia is internal medicine specialist Dr. Christopher Ockery, who works in Mayo Clinic's Fibromyalgia and Chronic Fatigue Clinic. Welcome to the program, Dr. Ockery. It's nice to meet you.
Thank you for having me.
It must be a pretty severe problem if Mayo Clinic has its very own fibromyalgia and chronic fatigue clinic.
I wouldn't say it's a severe problem, but it's one that's very commonly encountered, and a lot of people have it. And it's one of these conditions that often goes years before we get a diagnosis, and it really does affect people's lives.
What causes that pain?
It's unclear. There's a lot of thoughts in terms of what might be behind it. Often there are some conditions that have happened in people's lives that are traumatic, involve illnesses that then will serve to basically traumatize a certain part of the brain. And that is thought to then lead to amplification of these signals associated with pain and other symptoms.
So I think that's one of the first places that people get confused is that people will think, is it psychological pain or is it real pain or is it one and the same?
It's definitely real pain. If you talk to people who have fibromyalgia, they do feel severe pain most days, and it's a lot more than the pain that you and I would normally feel. So the thing we think about with fibromyalgia itself is when you have pain, normal everyday aches and pains that you have are going to hurt more than they otherwise would. We call this hyperalgesia. The other side of things that can happen with fibromyalgia is also what's called allodynia, which is things that ordinarily wouldn't hurt, such as touching the skin, will hurt. And those are really the two key things that we see as a part of fibromyalgia.
So, Dr. Ockery, what causes fibromyalgia?
Again, this is something that we're not completely sure. It's poorly understood in terms of the exact cause, and it seems to be a little bit different for each person. One thing that we do know just from twin-based studies, that it's about 50% environmental, about 50% genetic. And this is why we will see that often when someone has fibro, you will see family members who've also had fibromyalgia or similar symptoms.
If you have fibromyalgia, do you have pain all over your body, or is it like a joint or just the back or just the feet? How does it work?
It's so fibromyalgia itself is basically characterized by widespread pain, and so it's more than just one joint. Often, one of the places we think of fibro is in the cape region, so the upper part of the back, the front part of the chest. But in general, it is widespread, involving more than basically more than 3 of the 4 quadrants of the body.
And do we know why that's so widespread?
So it has to do with just widespread pain amplification. And so rather than so for example, if you were to have knee pain, you would have knee pain and just experience that in that joint. With fibromyalgia, you would not only experience the pain from your arthritic knee, but also pain from other parts of your body, and all of this would be amplified.
So there are risk factors associated with it. You mentioned the genetic linkage. What about other risk factors?
None as far as we know.
Okay. And then, as you say, pain can be very subjective, and there's different types. There's burning pain, sharp pain. What type of pain is this?
So often our patients will describe it as a achy pain.
Okay.
Sometimes, though, it really depends on what the underlying pain is. And so with fibromyalgia, you'll end up with a amplification of other pain you might have. And so let's say you do have arthritic joints. The pain from those joints will be amplified. And so that can be a dull aching pain, that can be a stabbing pain. It really depends on the underlying character, but whatever type of pain it is can be amplified. You mentioned neuropathic, kind of that pins and needles pain.
Yes.
That can be amplified as well. And so some of our patients who have this, but also have type 2 diabetes with neuropathic pain, that can be very debilitating because that pain is also made worse. What's
the difference between chronic fatigue and fibromyalgia, or are they one and the same?
They're not one and the same, but there is often overlap. If you were to look at patients with fibromyalgia, about 60 to 70% of them will also meet the criteria that we go by for chronic fatigue syndrome. They are very much related in terms of some of the things happening behind the scene with the processing of pain signals. Turns out a lot of the signaling that has to do with fatigue is also moderated by pain nerves. And so that's where a lot of the overlap comes from.
So if someone has one, are they more likely to develop the other?
Not necessarily develop, but it's just an association that we know that fatigue is a big part of what we see with fibromyalgia. And a lot of times people with fibromyalgia will also have a lot of the severe debilitating fatigue that we'll see with chronic fatigue syndrome.
They're cousins, Tracy.
Somewhere in the family tree.
So when you try and diagnose this, how do you do it? Is there a test for this? Is it based on the history?
So there's a few things, and this is going to go through a little bit of the diagnostic history.
Mhm.
So back in 1990, it was when the American College of Rheumatology came out with a set of criteria based on tender points. So more than 11 of 18 tender points in various different parts of the body. This did a pretty good job with identifying some patients with fibro, but did leave a large group of patients who have this condition off, mainly men. And so through a series of changes in diagnostic criteria, starting off in 2010, 2011, the diagnostic criteria has changed, where we no longer are using those 18 tender points, but now look at pain in widespread parts of the body, and also with other symptoms such as cognitive symptoms, sleep symptoms, and fatigue symptoms. And all these really do play into the current diagnostic criteria for this.
So there's no sort of blood test or an X-ray or a bone scan, for example?
There is not. One of the other key developments within the new, most recent criteria in 2016 is it's no longer a diagnosis of exclusion.
That's what I was going to ask next. Is it just because it's not anything else, and that's how you finally get to, and so it must be fibromyalgia?
Absolutely not. So it's one of these conditions where you can absolutely have fibromyalgia plus lupus, rheumatoid arthritis, or any other condition that causes pain. What is behind fibromyalgia is the amplification of these normal pain signals. And so often what we think about with this is if you have one of these other conditions and the pain that you're experiencing is something where it's much more than you would expect based on the degree of pathology. So if you have arthritis and there's not very severe inflammation or joint destruction, this could be something where your pain is being amplified, and fibromyalgia should be something that you should think about as a reason for that.
So apart from living with the pain, if you ignore it, is there any complications or anything bad that can happen to you?
No.
Okay.
You're just in pain all the time, which is kind of affects your quality of life. I mean,
Sure.
I'm not a doctor.
Yeah, no, it would do.
And so it really depends on if the cause of that pain is something that otherwise needs to be treated to prevent other bad things from happening, then of course that should be looked into. But what a lot of we spend when it comes to treatment for this is to get the mind not focusing on the pain as much, but more focus on what you're able to do and to improve function.
Dr. Kakar had asked about if there was a blood test, and that would certainly make things easier if you could do a blood test to find it.
Absolutely would.
But you had mentioned previously that it does show up genetic-wise. If you go and get a genetic profile done, does it show, oh, you are likely to have fibromyalgia?
Unfortunately, not. There have been genome-wide association studies that have looked, and they look at these large data sets and identify some correlations that are definitely not causative. We have not identified one specific gene with this, or even a cluster of genes that are thought to be behind this. It is one of these things where we just notice that people who are twins who have been raised in similar environments versus different environments, there appears to be about 50% contribution from each.
It's got to be frustrating for patients to not be able to, have it diagnosed by something that's like a blood test, something, I don't know, finger quotes, easy.
Absolutely. And a lot of times our patients will go many, many years without a diagnosis. And they'll come and visit with us, and we'll start kind of putting two and two together, connect the dots, and really does explain not just the pain symptoms, but the whole host of other symptoms that we'll often see with fibromyalgia.
Does it come and go? Is that why it can take so long too, that they'll have some good days and some bad days, or is it pretty constant?
Absolutely. So one common thing a lot of our patients with fibromyalgia will experience are good days and bad days. Some days they will feel great, do too much, and then pay for it the next 2-3 days in both pain and fatigue.
Well, I think, in 2019, we're a lot more aware of this. I mean, I think when I was in medical school, as you said, it was a diagnosis of exclusion. But now I think with, as you said, the criteria for diagnosis, I think more of us in the healthcare arena are more aware of this.
Yes, it is something that is becoming less taboo, is one way to put it. where a lot more clinicians are starting reaching out to us and trying to understand and learn more about this condition that they may not have heard about as much during medical school.
We've been discussing fibromyalgia with Mayo Clinic specialist Dr. Christopher Acri. We're going to take a short break, and when we come back, we'll talk a little bit more about treatment options and discuss what's happening at the Fibromyalgia and Chronic Fatigue Clinic at Mayo Clinic.
Welcome back to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McRae.
We're talking about fibromyalgia with Mayo Clinic internal medicine specialist Dr. Christopher Acri. So, Dr. Acri, if there is no cure for fibromyalgia, what hope can you offer patients?
So the way we approach fibromyalgia is really to try to identify if there are ongoing stressors that might be contributing to the continuation of the increased pain. And so that's step number one. And so in doing so, we try to identify different approaches that might work depending on each individual patient. And so,
how do you do that?
So meet with them, find out a little bit more about the background, how the process developed, what has been tried in the past, what has not been tried, and then start there.
A little bit earlier, before the break, you mentioned someone can feel really good and then maybe be too active, and the next day pay for it. What do you mean exactly when you said that?
So when you talk with people who have fibromyalgia, they'll tell you they have good days and bad days.
Mm-hmm.
And so life happens, and whether or not you feel good or you feel bad, things start to add up on your to-do list.
Mm-hmm.
And when you have these good days, a lot of our patients will feel very much like they have to go and complete everything on that to-do list. And then, of course, the next few days is when they pay for it, meaning they have more pain, more fatigue based on overdoing it.
That's what I was wondering. So there's what they usually would experience as pain is just amplified even more?
That's correct.
Go ahead.
So how do these symptoms then relate to one's psychology? So, for example, in the winter seasons where you get seasonal affective disorder, does that sort of lead into patients having more symptoms associated with fibromyalgia?
So a lot of the time our patients are living in chronic pain, and chronic pain in itself is something that can make people's mood feel down. And so when certain symptoms are also known to be made worse over the winter months, all these different things can stack and certainly can amplify certain symptoms.
Tell us a little bit more about the fibromyalgia and the chronic fatigue clinic at Mayo Clinic. How many patients do you see?
Absolutely. So we see about 50 per week over there, and we do an evaluation to clarify that they do have fibromyalgia. Sometimes we do see some other conditions that are mimickers, and we try to rule those out. And then we'll also see people with chronic fatigue syndrome. And so once we have established the diagnosis, we spend a lot of time, about an hour, on just education. There has been a lot of misinformation about fibromyalgia itself over the years, and so we spent a lot of time knocking down some of those myths, as well as helping people understand what they're experiencing in addition to the pain symptoms may be contributed from fibromyalgia.
I was wondering about that, if you're seeing patients or also you're helping to educate providers.
So if you've seen one of our clinical notes from this, it's quite long and detailed, and a lot of it is targeted because the way we use our notes nowadays, where you can go ahead, print it off, and bring it back to your local doctors to help continue care. And so we do a little bit of both.
So when you talked about the myths associated with fibromyalgia, what's the one myth today that you want to dispel about that condition?
It's all in your head. Because it's not.
Okay.
And you talk with our patients with fibromyalgia. This is clearly a pain that they're experiencing. It affects them day in and day out, and really does affect their quality of life.
That's a huge deal, though,
Mm-hmm.
just to expand a little bit, because if it's all in your head, the patient, the caregivers and family members, and the providers, if all three different areas are some version of it's all in your head, that's a huge part of this illness.
Absolutely. And telling a lot of our patients as we're going through the education process, all the information that has come out that really dispels that myth is really powerful. And basically getting them to the point where they're understanding that what they're experiencing is real, despite what they've been told over the last 5, 10, 20 years in some cases, can be quite powerful.
What are some treatment options that you have for patients?
So one of the difficulties with this is a lot of the medications, or people with fibromyalgia tend to experience more side effects with certain medicines than others. And so often our medication that are available to us, we're really limited to how high of a dose you can go up on based on side effects. And so there are a few SNRIs that are available that can be used. There are a few gabapentinoids that can be used for this. But some of these will make you more sleepy. Some of these will cause dry mouth, confusion. And so a lot of the first line therapy we think of for this is not pharmacologic.
You know, the first thing I want to ask you is, why are people more susceptible to side effects? And I bet you don't know.
We don't know for sure, but one of the things with fibromyalgia and this underlying concept called central sensitization is sensory signals are being amplified, whether it's pain, fatigue, but also some of the other sensory modalities that the body has, including things that happen within the GI system. We see a lot of our patients with fibromyalgia have an amplification of GI side effects such as nausea and the stomach discomfort. And these are often the side effects that cause people to stop taking these medicines.
Mm-hmm.
And so we really do think a lot of it has to do with this amplification of sensory signals.
So if we move away from traditional medicines, are there any alternatives that one can use to treat fibromyalgia?
Yes. So a lot of what we do from a non-pharmacologic side, so beyond education, part of it is lifestyle, is promoting healthy lifestyle change, focusing on wellness, focusing on things like biofeedback. A lot of integrated medicine approaches that work towards pain reduction and reducing the nerve hyperactivity.
I see. Now, a lot of fibromyalgia patients have genuine organic pathology and may need an operation, have surgery. But as a surgeon, we're worried about operating on these patients because we think we'll make their fibromyalgia worse. So can you sort of explain what one should be thinking about when we're treating fibromyalgia patients if we're thinking about doing a surgery?
Absolutely. So if you think of fibromyalgia as a normal pain that you would have being amplified, that's not tough to predict what might happen after a surgery. So surgery is painful. And so what we tell our patients is they expect that after surgery, you're probably going to have more pain than the person that's in the recovery bed next to you, and anticipate that. And as a result, you may have a little bit more difficulty with getting adequate pain control after surgery. And so sometimes we'll tell our patients that if there are ways that you can delay putting off an elective surgery to focus on optimizing risk factors or maybe pursuing non-surgical options, sometimes that can help from a pain standpoint. But if something where you do need to have surgery, whether it's elective or whether it's non-elective, then expect that your pain will probably be worse than other people.
If on the one side of the coin, what patients hear is it's all in your head, I would think on the flip side of the coin, that would mean that mindfulness and biofeedback and those things have to be very helpful.
They can be. And so when we've followed our patients at the Fibromyalgia and Chronic Fatigue Clinic for some time now, what we've identified is that a lot of our patients will have a pretty significant reduction in their pain levels and improvement in functioning without initiating any pain medications through the integrative medicine approaches, biofeedback, mindfulness techniques, sometimes things like acupuncture, acupressure, massage therapy. All these things can be very helpful with reducing that nerve hypersensitivity.
What's the one thing that works the best? What's the first thing that you tell patients to try?
Honestly, I don't have one thing because it really depends on each individual person's kind of preferences. There are some of our patients who love massage and some that will, that's the worst thing you can possibly think of.
And what about research? What research is being done?
There's a lot of ongoing research into underlying mechanisms for this and some more research ongoing into different types of therapeutic options. Not much of it is ready for prime time, though.
But yeah, you can give a prescription for massage. I think I've got some trigger points as well after hearing that, Dr. Acri.
We've been discussing fibromyalgia with Mayo Clinic expert Dr. Christopher Acri. Dr. Acri works in the Mayo Clinic Fibromyalgia and Chronic Fatigue Clinic. Thank you for joining us.
Thank you for having me.
So, I know that was probably a lengthy video, but I really think it was important to have a comprehensive look at what this is. And I really appreciate when he was talking about the myths, because there is a myth behind, and it has gotten better. That video was 2019, and we've seen the progression they were bringing up in 1990 when they used evaluation of 11 out of the 18 the tender points. So I had taken a few notes again when reviewing the video, but what really sticks out is the fact that they spend so much time in that education and empowerment piece for the actual client and their family, that patient and their family, to help them realize that this is really an authentic this is an authentic, this is real, it's a disease, it's not all in your head. So he had used that word empowerment because I think it's probably very freeing for someone who's going through this to know that, no, I'm not making this up. No, this is real. My pain is real. So if you know someone, we use this show to kind of educate and advocate and, uh, yes, and to really give knowledge base, right? So if you know someone who has this diagnosis or who is potentially getting diagnosed, please be that supportive network and hold space and really hold the fact that this is a real condition. I remember this was probably 15 years ago, and I had a coworker who had fibromyalgia. This was way before in this real myth period. I think they always thought she was making things up. And there were times where she was probably grumpy for a reason because she was carrying so much pain in her body. Now, I just want you to imagine yourself when you have some minor aches and pains, right? It does take us, I mean, it does take us away from something. It definitely makes us focus on the pain. But can you imagine having that debilitating pain consistently and all the time? It's a whole different gamut, right? A whole different gamut. Some of the things that I noticed that I really appreciated, again, he said it's all in your head. No, it's not, right? He really was trying to help that, trying to debunk that myth. And I also appreciate the fact um, when the commentator was asking, like, what is the number one go-to for you? And he said, it just depends on each individual's preferences. And this is for anything. So when I am working with clients and when coaches and therapists and whoever, clinicians in any field, when you are working with a client, you always want to make sure that when when the mirage of a la carte services is offered, what's going to stick with them? Meaning, what is their individual preference? Because we have seen research show us that when there's an individual preference that's linked with the actual activity or the intervention, then that's when that systemic change can occur. And in this case, help do that pain reduction that they were talking about. So again, some of the themes that I heard them talk about and that you probably heard were that biofeedback. And if you know about biofeedback, that's a really great, and we often have recommended biofeedback for some kids that have been diagnosed with ADHD because it can really help to really have a system to kind of just really gauge and kind of um, almost like slow down your system a little bit. Biofeedback is really helpful in that realm. So I thought it was really interesting that they brought it up for fibromyalgia. But again, then connecting when it's getting to that idea of some of that nerve sensation and nerve pain, and when they're talking about pain signals in the body, then it started to click for me that biofeedback might be a really interesting approach. Also, he discussed integrative medicine, which is exactly where we are going into. Functional medicine, integrative medicine is huge. That mind body connection, right? The idea behind all looking at the person in a holistic lens. So that was really, I found a key point that was important to bring up. And of course, mindfulness. Um, I don't know if I shared with you. I've been in an 8-week mindfulness program myself, and I have loved it at MBSR with John Kabat-Zinn's program, where he helped design this awesome program of mindfulness and has taken keys from the East and Tibetan Buddhists and all the integrative work in even the US with mindfulness, and really helped to highlight how the practice needs to be about us and all. But I really appreciate the fact that they brought up mindfulness, so that because with chronic pain, you can focus so heavily on the pain. So how do you go inside of yourself in the moment to um, actually heed to the pain, to pay attention to the pain, but then also to release that pain. And so that was interesting. And the massage therapy, I'd often thought about how would fibromyalgia look in the lens of massage therapy. I didn't know if it would be something that would be, too painful on touch. But then when he said it's based on the individual preference upon touch, that made a huge amount of sense. And then, of course, you want to look for somebody who specializes with fibromyalgia. So when you're doing your research, if you are someone who suffers from it, you would want to look at someone who has extensive body work experience with fibromyalgia, or in the idea of chronic touch pain, or any of those points. And then acupuncture, acupressure, which I am a big fan of. And again, I was also very curious about that, and how even that little initial, like, how does that go and how does that release? But then I just believe in acupuncture so much that once you start to really get those points down, then really reinvigorating that chi, that energy center, and shifting. I was like, well, I love the fact that it can provide some relief. So I really appreciated that approach. But if you notice, there was a missing link, which over time we'll get Amanda to fill us in on, is this nutrition piece. Because the commentator and the doctors, they didn't facilitate a conversation on nutrition. They used the word wellness, and wellness is a really big category for our physical, our emotional wellness. We've talked the dimensions of wellness. I do this a lot with my clients. There's a wellness wheel. What are the different pie pieces to it? And the fact is that we didn't necessarily approach that part of nutrition. And I know it was just a 20-minute talk, but I was just very curious on, they had talked about wellness, but not the fact of like nutrition, and bringing it down to what does it look like for physical movement? Has Tai Chi been helpful? Or I've just recently been introduced to some Qigong movements through my mindfulness instructor. And I had took Tai Chi years ago, and I just loved it for that slow, fluid movement, very mindful movements. And I could see how that would be really interesting to see what that would look like for someone who does have that sharp, debilitating pain, those slow, steady, methodical movements, and really making their practice their own for some body movement. So again, like any diagnosis, that education piece is so critical. I know sometimes before a diagnosis, we will research, but actually the critical juncture point as consumers of information is to research from scholarly sources that are doing great, like research based, right? For instance, Mayo Clinic does amazing work. You always want to make sure, where are you getting your information from? It's really important from a scholarly lens. Number two is the fact that you want to educate, once you have the diagnosis, to look at the holistic piece, right? So that you can discuss with your physician and your care team how to look at the diagnosis. And this isn't just for fibromyalgia, but in general, right? How are you going to look at the holistic piece? And you yourself are your best advocate. So writing questions down, writing down different things, looking up the pharmaceutical approach, looking up different approaches, looking up what integrative medicine is looking, that whole pie piece of wellness. And I think that is critical in having conversations with our physicians, and they're ready for it. And we have to be ready to do the work too, about examining what is happening. I found fascinating that they said 4 million. So 4 million people are diagnosed with fibromyalgia, or have, and this is 2019 results, which tells you exactly what a huge number of folks are facing this condition. So it is widespread, and it is something that we need to really take a look at, because how stressful can it be when, very similar to the idea of many of our disorders and diseases, that we don't have an explanation for. He had mentioned it's about a 50% to 50% environmental, 50% genetic. So again, there's no scans, there's no way of really being able to tell at this point, right? And then they have to rule, which I thought was great, that it's not like, okay, we've ruled out everything else, now let's put fibromyalgia. That's not what they said, that those that has definitely changed, which is great because it's not the rule out condition. Um, and then they did discuss the idea of chronic fatigue syndrome, the idea of it going parallel together, right? And the relationship of it overlapping, and that the pain signals and the pain nerves, and how those kind of interact together. And I really appreciate that. Again, it's not a diagnosis of exclusion. I had taken a note on that as well. What I think was really important to highlight was this wording of pain amplification. This condition is about pain amplification, right? For instance, Amanda this week has had a lot of pain. I mean, she had contacted me and let me know that it's just been that this condition has taken over her week, right? So it doesn't allow you to, you're basically just in survival mode. So I just want us to really be educated in the fact that A, if you know someone, B, if you have come into contact with someone who's had it for years and you might have looked the other way, maybe it's time to look inside from today's conversation, and perhaps if you feel it in your heart, give them an apology and saying that you're receiving education and that you hadn't known. And I just want to remind you, debunk the myth of it's all in your head, right? When someone's in pain, I'll give you the example, since I just, of course, just worked with grief the last 4 days in my intensive training. When someone's in pain, when somebody is grieving a physical loss, right? We feel for them. Our heart goes out. But then here with fibromyalgia or some other pain-like conditions where people just say, oh, no, he talks about that pain all the time. He's just making it up. Oh, it'll go away, right? No, they are also carrying weight with this pain day in and day out, moment by moment, breath by breath. It affects that quality of life. It affects relationships. It affects all of those, the wheel of wellness. So please be kind and humble. Be kind and humble to knowing the fact that at this point in 2021, when we have so much awareness, so much research that this is a real condition, and the ones that do come out, even if we don't know where their root cause is, even if we can't tell it on a scan, that they're real, right? When someone faces pain in their cancer diagnosis, we hold them, right? We hold them. So how about we hold, even though there's no scan that this is coming up on, right? But still, the person is telling us they are in chronic pain. Then take their word for it, right? 9 times out of 10, I'm not sure that we've fallen into this pattern of thinking people are lying to get attention, right? People are lying to get attention with making up physical symptoms. I really challenge the fact of how many people it is that actually goes around telling lies about how they're feeling, right? I'm feeling nauseous, so I'll get out of doing my work. I mean, I'm thinking that the times have changed where we use our physical symptoms to get out of things, because guess what? Your work just compiles and compounds and it's not going anywhere. So the days of us telling people, oh, they're just making an excuse. Now, if you are someone who's been surrounded by someone who uses their health as an excuse, I would dig deeper and say, what is it? What is it that's making it so hard for you to be able to do your work, right? What is it about this? Why is it that you feel like you have to tell me something that's not true about how you're feeling, or whatever it is? Dig a little deeper. What is it? What is that anxiety that's happening for that loved one that they are having to lie about how they're feeling, right? It's probably anxiety and fear. But again, I want you to go from heart center. Trust first. Oh, I don't even remember the verses right now, but right? Trust until you give me a reason not to. And then when somebody has lied, and I'm getting off tangent, but it's still related. When someone has lied, then you help make sense of it. And then you look at the factor of having compassion and figuring out, digging again, right? But again, the expression of pain in our bodies, I do want you to examine now that most people do not do that, right? They're not making it up, especially in this condition. If you can walk away with today knowing that it's real, the person manifests this pain all over their body. Yes, we don't know the causation. There's still a lot of research being done, but please give it value. Give your person, give your family member, give your loved one, give your friend that space and permission so that they can come to you to express their pain. Or you look into the channels with them on days that they're feeling good, right? Good days and bad days. Help them express what their good day will look like. And helping use this integrative approach. Have conversations about what's working for you, what's not working for you. Be part of their care team, right? So that they don't have to spend so much time in that, oh my gosh, I feel so relieved that my doctor's telling me this is real, right? Because they're carrying that emotional burden. We've talked so much on every episode about where it's housed, emotional burdens that carry forth and then play a role in our physical health. So again, be part of the care team. As always, I want to thank you for your time. I also want you to take some great rest in whatever you do with your friends, family, and always, always be grateful in whatever journey that we're on, right? What I mean by grateful and always is just remember, and if you can find a way while you're celebrating with your friends and family, if you are, for Thanksgiving, if you can also remember to give back in some way. There are people who need our love, who need shelter, who need clothing, who need food. So if you can find in your heart to be compassionate also. And I know for so many that you have waited to be reunited and physically with your friends and family, but also remember those that come to your mind that are alone and isolated, and to keep them also Zoom call, FaceTime, find a way to include them on these holidays, because the holidays, and we'll be talking about that over the next few episodes, the holidays can also be hard for some. But regardless, I'm so thankful for you and the community that comes and listens and that tunes in and takes care. So I wish you a great week ahead. We will have some pre-recorded episodes over the next couple of weeks while myself and the production team also take some rest with our friends and our family, so that we can we can continue to all do better by taking care. Have a wonderful week ahead and happy Thanksgiving.